Hello everyone, welcome to the month of October, which is Breast Cancer Awareness Month. I am Saada Sadiq, a senior midwifery officer, Kolebu Teaching Hospital. You can call me International Midwife. Breast cancer is when healthy cells in the breast change or grow out of control to form masses, which we call tumors. These tumors could be malignant or benign. That is, it can be infectious, or should I say invasive, and benign meaning that it's not causing any sickness. Talking about breast cancer, every female is at risk of developing breast cancer. So far as you're a female, grow up to get hormonal changes or growth changes that are influenced by estrogen and progesterone, you are prone to getting breast cancer. If you have a family history of cancer, either being breast cancer, any form of cancer, ovarian cancer, then you are at risk of developing breast cancer. When you are a female and you have early menarche, as in your menses comes before 11 or 12 years, and you have your menopause after 55, you are also prone to getting breast cancer. This is because your reproductive life has been exposed to estrogen and progesterone for a very long time. If you're also an elderly primate, as in you have your first pregnancy or your first delivery after the age of 35, you are also at risk of developing breast cancer. Also, if you are a mother or a female who has never breastfed a child before, you are also at risk of developing breast cancer. If you are a female with a more denser breast, you are at prone of getting breast cancer. Denser in the context that there are more connective tissue than fatty tissues. All the above mentioned risk factors are very natural and you can't do much about it. These are natural factors that would prone you to breast cancer. I would like to talk about risk factors that you and I can do something about. That is 1, being overweight. 2, taking in alcohol. 3, with cigarettes. And also the 4th one is your exposure to radiations. All these are things that you and I can do something about it when we prevent our risks or our contact to all these 4. We can reduce our risk of getting breast cancer. There are symptoms that one would see and know that she is or might be getting breast cancer. These are changes you see in the size of your breast or the nipple. And then the shape of your breast too might look different from normal. You might see a bloody discharge from your breast or any other discharge aside breast milk coming from your breast. You might find a lump on or in your breast. And you might also see indentations, or should I say a part of your breast being deformed. Or you might feel that the texture of the skin of your breast is looking different than the usual. Also, you might see redness on your breast or swelling of the lymph nodes, and these might hurt. When you see this, kindly report it to the nearby facility for you to be assessed. When you get to the facility, these are some of the diagnostic care that will be given to you to know if it is breast cancer. When you report to the facility, you would be assessed to find out what exactly the problem is. Further examination or investigation to really diagnose you will be an ultrasound of the breast or a mammogram. A mammogram would give you an accurate information of what is really happening in the breast. A breast biopsy can be done, or MRI of the breast can also be done to diagnose breast cancer. But before this, what would I do to prevent myself from getting breast cancer? To prevent breast cancer, I would encourage all of us to live a lifestyle free of alcohol and cigarettes. Try to control your weight and make sure you get regular checks from the facility yearly, or if you feel you have a family history of breast cancer, try and get these assessments like a breast ultrasound to check you day in and day out. We know that breast cancer has no cause, but we can prevent it day in and out. In order to prevent breast cancer, this is what we encourage every female to do. You try as much as possible to do your own self-breast examination 2 to 3 days after your monthly period. This can be done in the shower, it could be done in bed, it could be done in front of a mirror, and this will help you to identify any changes that come into your breast. Also, if you are from the age of 25 to 39, we encourage that you get a breast assessment from a facility that is approved within a year and 3 years in your life. So every 1 to 3 years, we encourage you come to the hospital for the assessment. But if you are 40 years, we encourage you do it yearly and ensure that you get a mammogram done for yourself each and every time. In this month of breast cancer awareness, I encourage everyone to walk into a health facility and ask to be screened. You can be screened by breast examination, breast ultrasound, or breast mammogram. Join me through the month of October as we create awareness for breast cancer. Thank you.